Hello everyone, my name is Daniel Cho, and on behalf of the Ontario Public Health Association, welcome to today's webinar. Before we get started, I would just like to repeat a few announcements we made at the earlier. First, the webinar slides are available for download from the materials pod. This way you could have a copy of the slide deck and take notes during the webinar. Also, we encourage you to share comments and questions in the Q&A pod at the bottom left-hand corner, and we will address as many as possible following the presentation. If you require technical assistance, please chat with OPHA host. And as usual, our webinar will be recorded and made available on OPHA's website and YouTube channel following the session today. Today's webinar is hosted by the OPHA New Professionals Network. The network is led by students and new professionals and provides members with opportunities and a platform for professional development, networking, engagement, and continuous learning, offering an edge to those pursuing employment or career advancement in public health. We would especially like to highlight our involvement in OPHA's 2017 Fall Forum. The theme this year is the public in public health, and we will be providing practical learning and networking opportunity to better understand the demographic, social, and political trends influencing public health and how we can better engage the public to advance our goals. The New Professionals Network will be hosting several learning and networking events at the forum, especially geared for students and new professionals, and there will be an excellent discounted rate for students, so we encourage you to keep an eye out for that. I'm joined today by the co-chair of the New Professionals Network, Anjum Sultana. Anjum graduated with a Master's of Public Health from the Dalla School of Public Health with a specialization in health promotion and a collaborative in public health policy. Currently, she works as a junior fellow at the Wellesley Institute, and she is passionate about health equity, diversity, and civic engagement, and participates in volunteer and professional work related to these issues. We'll be talking today about social media and how we can use it to promote our own personal brand. The field of public health is vast, and while this presents exciting opportunities, it can also be challenging for professionals to identify our unique interests and strengths within the public health sphere. So many public health professionals have recognized the promise of social media as a way to develop connections with others, discover opportunities, and foster continued learning and growth. So during the webinar today, we are going to focus on three things. First, to recognize the benefits of a professional social media account. We will also discuss effective strategies to build a social media following and market our unique interests and strengths. And thirdly, to learn how to build a meaningful and sustainable connections with other professionals. So I want to thank Anja for joining us today, and I'll now flip it over to you.
Great. Thank you so much for that warm welcome, Daniel. I'm very excited to be here today to speak with all of you about the power of social media. It's something in my 6 or 7 years engaging with it quite significantly. I've seen the impact that it's had in my personal career, in my personal growth, as well as my professional growth. And I really believe that public health has a strong place in social media. So I'm very excited to talk about that today. So Daniel spoke a bit about the objectives, so I won't belabor the point. Sorry about that. So Daniel already mentioned the objectives, so I won't belabor the point there. What we want to do is talk about how social media can be helpful for your public health career. And today I'm going to give you a few short but meaningful tips and tricks that can help you really take your social media presence as it relates to public health and take it to the next level. First, I'd like to know who is out there and listening, and I want to also tailor this conversation to some of your needs. So I have a few questions that I'd like everyone to chime in on the chat here on the webinar platform. So some of the questions I wanted to know about everyone listening is, what stage of your career are you in right now? Are you currently in the first part of your stage, as in you're currently in school? Are you someone that has recently just joined an organization or joined the workforce in public health? Or are you someone that is currently either well established and looking to see how social media can add something to you? So if you could just write that in. So I'm getting a couple comments already. So I see someone's been working in the field for 20 years, and someone is on the other end where they're in school right now in their second or last year of public health. So someone else also quite established. I also see people have multiple social media accounts, so they're using that in different amounts. Someone's a recent MPH grad and new to the workforce, and Erica is a young professional and has been working for the last 10 years, and health equity and social policy is your focus. I also see people from all across the GTA, from Halton to Toronto to more. And also, okay, so people are using it for their professional organizations using Facebook. Okay, the next question I had was, what is your area of interest or specialization? Is there a particular aspect of public health that you are focused in on, or you want to focus your social media work around? And I can see if I can give some tips about the types of content you might want to put out, or the types of places you can search out for community. So I see here someone saying healthy families. Okay, reproductive and child health. So there are a few social media tricks for that particular focus area. Adult years, preventing falls, chronic disease and injury prevention. Again, another reproductive health. Okay, specifically using it for health campaigns. So that's quite interesting actually. And built environment. Okay. See a couple more people chiming in. Aging, disability, social care, very important, especially with our changing demographics, and communicable diseases, so infectious diseases. Great. And the last thing, you can kind of tie these two together. What are you hoping to get out of today? This will be helpful in terms of tailoring the conversation, so I can answer some of the questions you might be having top of mind. Oral health, okay. Or that might be your area of specialization. How to reach specific audiences. Okay, great. I'll make a note of that. Increasing dialogue with social media users online to discuss health topics and promote healthy change. Okay, so having more conversations online about these topics. I hope to learn how you can maneuver around the social media space topics that may be seen as contentious while not impacting your current role of your organization. That is an important issue, especially if you're using it for professional purposes. And I see here, I'm hoping to learn how to use social media to use my knowledge in a form that's engaging, exciting, and usable. Okay, so I can direct you to a few resources that might be helpful. Full days on FB, 5 days per week, different programs focused on each day. Okay. Tips on using social media for a community campaign. In my case, fall prevention among the adult population, including seniors. Okay. Seniors prevention. Okay. And I see, give it about one more minute. Want to learn strategies for increased engagement and whether social media is a tool that can be used to better connect to communities in a meaningful way. Okay, so that's a great question. How do you connect to communities in a meaningful way, not just connect? Okay, so this is great to know about some of the things that are top of mind, and I hope to address some of these and hopefully many of these in the conversation that we're having today. Great. So what I wanted to start off, thank you so much for telling me a bit about yourself. I want to tell you a bit about me and my journey and how social media has played a role. Back in the late 2000s, I started my undergrad degree, and I started on what I thought was the final frontier, and that was neuroscience and psychology. And I did this degree because I thought this is a place, this is a part of the body that we don't really know much about. In high school, I was very interested in biology and really interested in how systems work. And I thought, you know what, it would be great to know more about systems at a biological level. especially the brain. And this brought me to a lot of research and a lot of work in the academic sphere, and I was involved with different research projects. But I realized that there was something missing. There was something missing with this intensive and very important focus on the biomedical, but how does this relate to a person's lived experiences? How does this relate to how they navigate the world? How does this relate to the other factors that might be impacting their health? And for this reason, I started doing a lot more community involvement. I was involved with different student groups. I was involved with doing healthy living, volunteering on campus, being a volunteer, providing different health promotion programming on campus. And that really started my love affair with public health and really learning how to take this biomedical knowledge and connect it to the social and political and policy knowledge out there. Um, and I came across this quote earlier on in my undergrad, and it really, really shook me, and it really changed the way I thought about things. And it was this quote by Rudolf Virchow, and it was, medicine is a social science, and politics is nothing but medicine on a large scale. And you could swap out medicine for public health, and it does have that really similar perspective in that if you want to make people healthy, it's not just going to be at the biomedical level. You have to really look at how society works at a large scale, how systems work, how the social determinants of health work to really make an impact, whether it's on things like poverty, whether it's things like housing. This past year for the OPHA Fall Forum, it was focused on health equity, and health equity really looks at these broader social factors and how to make things more equitable or fair between different communities. Um, and so when I was going into that realm of thinking, I started actually looking at social media to find out more about what all these different topics meant. And social media has been very beneficial to me in my career, and I've seen it help me in many different ways. I've seen it help me in attaining job opportunities. I've actually been approached for job opportunities through my social media, whether it's through LinkedIn, sometimes Twitter, and sometimes these jobs are a great fit and sometimes they're not, but it's really interesting how social media can put your voice out there and people can start to look for the particular skills that you have, and I thought that was really beneficial of social media. I've also seen for folks on the line who are in their student or are currently students, I found social media really helpful for learning about scholarships. It's really difficult sometimes to know what opportunities are out there for funding your education, for funding your tuition. And I saw social media as really helpful for me during that earlier part of my year of my career. I've also seen social media helpful for really establishing yourself as a thought leader on a particular topic or area, and that can actually help you in terms of receiving speaking engagements. I've had opportunities, and I'll speak a bit about how I first came into public health. I had a few opportunities speaking on my global health or my international experiences because of my social media, and I've actually had a chance to speak at numerous college classes on global health because of what they saw on my social media profile, specifically Twitter. And that was really interesting. And finally, one of the key benefits I saw for social media is that it really broke the ice. It really gave me an opportunity to show to the world who I am and what I'm about from a professional perspective. And when I wanted to, connect with someone that I thought was really interesting, doing really cool work, I would see what kind of things that they would post about on social media, for example, Twitter. And, if there's something that I saw that was intriguing, I would, share a comment, have a conversation back and forth. And if I ever wanted to engage with them in an informational interview, it made the process so much easier than cold calling or cold emailing. So that was really, really fantastic. And so just to tell you a bit about my journey, so I came into the world of public health through my entry in global health. And in undergrad, I was very lucky to be in a program in health studies with a co-op focus. So there was this piece where you would have placements in other organizations. And I was very interested in the work on a global level because I'd read books by Doctors Without Border, the founder of the leader of it, Dr. James Urbinski. He has this book called An Imperfect Offering, and that really took that biomedical perspective and really contextualized it on a structural level of what's happening globally. And that provided me opportunities to go to Ghana, and then for my co-op placement, I was in Kenya. And in Kenya specifically, I was doing work with the Ministry of Health in this area in Western Province, in this city called Kisumu, specifically in a specific area called Mbale. And there I was doing work on doing health promotion programming with the Ministry of Health through my co-op placement. I was also engaging on a particular issue called jiggers, which is a neglected tropical disease that was endemic to the area that I was working in. And I really saw the social media for this particular project because it's an issue that, unfortunately, because of the lack of the fact that it's not as it's not an epidemic such as malaria, for example. There wasn't as much funding tied to that, and donors, when they did provide funding, they didn't provide it to funding to diseases that didn't have as much of a profile. And social media was really powerful in amplifying exactly what this disease was and what the toll that it took on people. And in fact, after coming back from my co-op placement there was this opportunity through a newsletter that was done by the Johns Hopkins School of Public Health called Global Health Now, and they actually asked, what are diseases on a global stage that are not being addressed? And through use of social media and through the use of this particular opportunity, I was able to help amplify information around jiggers. And so already in that global health world, I saw how impactful social media could be. I also spent some time in Tanzania, and social media was used there for some of the HIV/AIDS programming to connect with youth about different services and information. And it's really interesting to see how social media can be adapted for different contexts and different age groups. And hopefully I'll get a chance to speak a bit more about this later on. Next, I saw that from my experiences working in Kenya, I saw the importance of social media when it came to advocacy. And a lot of the work in public health has to do with things that are happening at that structural level. And in my first foray into the advocacy world, it was actually through the work that was done by Canadian Doctors for Refugee Healthcare, who opposed the cuts that happened to refugee health care a few years ago. And it was through social media, primarily Twitter, but also Facebook, that they were able to amplify their message of reversing these cuts across the country from coast to coast. And after many years of fighting very vigorously about this issue and ascertaining that this is a health equity issue, they were able to see that those cuts were reversed. And it was through my partaking in the stuff that was happening on the ground, but also online with advocacy, that I saw that social media could really amplify a message and really carry it across over time, over distances, and across different sectors. Finally, I saw that many of the issues that I was concerned with had to do with health equity. And when I was at my MPH program, I realized that we could use social media to really amplify issues that are not talked about often even in our public health sector that is quite knowledgeable about these equity issues. And one of the things that my colleagues and I, when I was in my MPH program, pushed was the focus on racial health equity and seeing how racism could be a public health issue and really examining and exploring that. And to really amplify our message, we use social media, whether it was using hashtags, Racial Justice Matters. We also, someone had mentioned other tools that they could use on social media. One of the things that we really saw was valuable in that space, especially if you're using platforms such as Twitter or Facebook, are the use of images, and specifically the use of infographics. And one resource I want to share with all of you is Canva. I don't know if anyone's used Canva before, but it's this free website, free platform, where you can actually start to create images. And I believe that if you want, you can also pay for a more professional version of it, but the standard free one is quite excellent. And you can make infographics, you can make images, and this is something that you can attach to many of the messaging that you might have for your professional platforms to really amplify or really expand your reach and influence. There's research that shows that content that is accompanied with a photograph or some sort of visual component is more effective than just text alone. And as you might have seen, I've tried to embed that in the presentation so far. When there are images, it does lend itself to having more of a narrative quality to it. It's something that people want to share more. So if you want that viral nature to your social media content, that's really helpful. So check out Canva. That's an excellent resource that I would highly, highly recommend. In terms of really amplifying the issue of looking at racism as a public health issue, we were able to work with different outlets, newspaper outlets, to amplify this issue. So one in particular was New Canadian Media, which is a smaller scale newspaper publication, but because of the social media utility of it, we were able to amplify that message even more than if it had just been a blog post that we did. Using social media can be a powerful tool for sharing content on many different platforms, and it's really helpful in terms of creating content as well. We also saw that social media is really helpful for sharing good news, and so I was lucky to be part of a course at the Dalla School of Public Health that focused on looking at things like ethnicity, culture, and health. And this is just to show how you can really take those different aspects of what you are interested in and bring them together. So this in particular, this course focused on culture and ethnicity, but some of the conversations that we had in the course were, how do we use new and innovative ways of reaching out to diverse populations? And social media was something that came up as well. So now that I've kind of given you a bit about the story, my journey, I want to give you the basics of one particular platform, and that's Twitter. Unfortunately, I don't have the time to go through all the different amazing platforms out there, but I thought this in particular to highlight because was important because in the realm of public health, as well as in the realm of social media, this is something that's used quite a bit. It's usually the place that people go to get their first take on a news story. It's also something that is quite intuitive, and it's something that our sister fields of public policy and medicine use quite frequently. So there is that space for interdisciplinary communication, but also cross-sectoral. We see that many different players come into the social media world through Twitter, and this is a great way of engaging those different populations. So I just want to go through the basics, but I'm sure many of you might have already seen Twitter. But I just want to, just give people some basic advice on how to really amplify and optimize your social media presence for professional use. And so one of the first things I tell people is to please change your photo. Change it to a photo of your face. Having a great headshot is important. Having your organizational logo is also great if this is for an organizational social media account, but it's really important to have some sort of striking image, whether it's your face or a logo, to really show that you are a serious player and have a strong social media presence that you want to establish. The next would be to focus in on your bio. And I really want to highlight this because this is often where people come to find out what you're about. So if this is for your personal account, depending on how you feel about how you feel about putting your professional information right there on your profile, I encourage, if you feel comfortable, to put where you work. Put where you work and what your particular role is. This helps to establish your credibility when you are talking about an issue. The flip side of it, of course, is that you have to be very cautious about what you say, because this is not only a representation of you, but it's also a representation of your organization. And I can give a few tips about how you can work that line. I would also say, really, if you are worried about ensuring that your content is, just representing you, what I put in my account currently, when I was a student, I didn't do this, but when I started working, I put tweets and views are my own. This really establishes, yes, I am someone that is established in the field or coming up in the field, but that what I'm saying should only be reflective of me and not my employer. So if you're worried about that at all, I always encourage you to put that. And something else I've seen and something I've started is that RTs don't equal endorsement. This is, sometimes you might see something that someone's doing, and you don't know exactly everything that they have said before, said after, and you really might be just interested in that one particular thing that they've said. RTs don't equal endorsement just ensures that people know that you don't, just because you've retweeted it doesn't mean that that's exactly your point of view. They can always come talk to you if they want to know more. And finally, I would say put what you're actually interested about. I'm very interested in health equity and inclusion and civic engagement. So when people come to my profile, they know what kinds of topics to engage me with. This is really important if you're out there and you want to connect with people. People already have a point of conversation with you when they see that in your bio. And other people I see put their hobbies, they put other things that they're passionate about, but if you want to really invite people in and have that warm presence online, this is a way of doing that. The next thing I wanted to share was just the basics of constructing a tweet. It's 144 characters. Don't quote me on that. But in terms of what you put actually in your tweets, I would say one of the most effective ways is to always see points of connection. So, for example, I saw that my alma mater recently, a team from there won at a competition in the States for global health, and I tagged that organization. I also tagged the organization that they were at, which is in the U.S. And this is great because now that organization knows, hey, this person is engaging in content that is related to us, and they might retweet. That might also increase your presence or profile in social media, particularly in the Twitter space. And it's also just a great way of just saying congratulations and just sending good wishes an organization's way. And sometimes people ask, hey, what exactly should I tweet about? Things such as this that are positive, that are polite, that's the type of tone that really does well in these spaces. It's up to you to decide what you want your tone to be, but for people that are just starting off, that's what I would encourage. It's something that is not contentious, it's not controversial, and it really just shares something of value to your followers. The next thing I wanted to share was about hashtags. When it comes to the Twitter space, it's really a large conversation, and for people to engage in the conversations that you might be part of, it's really important to tag your content with the relevant hashtag. So for this, I use global health because that's what it was concerning. If I was interested in health equity, I would put hashtag health equity. A thing that's quite popular in Canada is hashtag CDN health, so that's Canadian health. You could also do hashtag CDN poly, because often the things that we are concerned with in public health might be related to politics, which is really a catch-all for what's impacting society. For people that are really passionate about social determinants of health, a key hashtag is hashtag SDOH. For folks that have said that they were interested in maternal and child health, the hashtag I've seen is MNCH, and that's been really helpful in amplifying content related to that. I've also seen hashtag Repro Health. So that's reproductive health for short. So I would take some time if you are specifically interested in a niche area of public health to research a bit about what that hashtag is. I've given you a few to start with, but you could always Google and see what else is out there. But that's something I would say is very, very important. And finally, likes. So this is one thing I would really encourage you to take a look at and be mindful of. So on Twitter, it does share how much you've tweeted. So you see you've tweeted 20K, and that's after about 7 years of tweeting, so don't let the numbers scare you. But it also shows you who you're following and who is following you. But the one thing people don't really think about is the likes. So this is when you actually like something on Twitter. It actually does keep track of that. So that might be something to consider. Sometimes we might not retweet something, but we might like something, and if it's something that you're worried about might be controversial, it might be better not to like it, just because it does keep a track record of it there. So if that's something that you are worried about, you can always go back and see what you've liked and unliked it. But I just wanted to share that because that's something that someone had brought up. Can everyone hear me all right? Okay. Sorry if the audio... Hopefully the audio is fine now. In terms of what actually to post on Twitter or post on social media, so the acronym I like to use is ROW, R-O-W, and it stands for three things. The first is read. So read. I think this is, if you really want to really engage with the space online when it comes to public health and social media, it's really important to see what is being said online, but also what is being said around on those topics of interest outside of the social media world. So this could be things like books that you could be reading, that you could be sharing content with in terms of what you want us to shared online. It doesn't necessarily also have to be actually reading. It could be content such as podcasts. I know a lot of my friends, they really like podcasts, especially how it relates to public health, but also all of their other interests. That's a content piece that they share, and I strongly believe that's something that a lot of people really appreciate, seeing that in their Twitter feed, things that they can go off and listen to and learn new things from. Also, if you are at actual events, I would say you should also tweet from from where you are. So whether you're at a lecture or you're at a conference, sharing that content is really helpful to the community that you're trying to establish on social media. In terms of actually finding this content, so if you're someone that really wants to know all about reproductive health, what you could do is actually set up a Google alert that tells you anytime an article comes up about reproductive health. So you can actually set the settings to send it once a day. You can ask it to send you an email once a week with all of the reproductive health articles out there. But that's a really interesting way of keeping on top of trends and information in your specific field of interest. If you're interested in chronic health, that's something else that you can set up a tweet about. There's also excellent newspaper ads that are really wonderful and integrated well with social media. So one right now that I use quite a lot is based from the UK. It's the UK's The Guardian. But I found that a really helpful app of being up to date on what's happening in different issue areas that I'm interested in. And what's really great is that it's really easy to post from that app onto social media. In terms of the O, so the O is organized, and really broadly speaking, this is just to start doing things in your community, and that's also a way of just furthering your engagement in the public health sector, but it's also a great way of creating content or sourcing content for social media purposes. So if you're an organization that is hosting conferences, so this is a conference that I organized in undergrad, it's really imperative, or I would highly suggest using social media to amplify your message. So if there are messages that you want shared beyond just promotion of the event, so if there is a speaker that has come in and done a particular presentation, you can actually live tweet during that person's presentation, but also integrate that with other social media tools like Storify. Storify is this great tool. You can, we'll see if we can put a link to the actual website here, but Storify is a great way of taking all the tweets that you may have posted during that person's lecture or talk and actually put it into a story. And that's what's really great about events that your organization or you organize. You have content that is not just timely and interesting at the moment as it happens, but for times after the event has already occurred. So this is a really great way of having more content to share. In terms of advocacy, so I mentioned this earlier, if you are engaging in activities outside of work that are related to your particular area of interest, so whether it's things like pharmacare or refugee health or homelessness, social media is also a great way of letting others know about this work and also encouraging them to participate. So this is for people that want to use social media to really establish themselves in personal but also professional setting for issues that you care about. So you can also amplify your external outside of work activities through social media. And finally, the part that is the hardest for people, but also I think one of the most significant things that a person can do is write. Actually share your thoughts. It's a bit cut off here, but what I wanted to say was become a thought leader. As folks that are well established in your career, I saw many people on today's presentation who said that they've been working in the field for 10, 15, 20 years. You have probably seen and learned a lot. Using social media, you can actually share those lessons learned with a broader community than you might only be able to do that might not be as aware of what you've done if you didn't use social media. So for example, if there is a particular program that you have done or a particular event that you have organized and there's some reflections from that particular experience that you want to share, social media is a great way of sharing it with the broader public and also inviting discussion and engagement. You can also do this through blog posts. I've also seen people take what they've learned and actually put that into an op-ed or a letter to the editor that they share with their local newspaper. And if that gets published, that's something that you can also share online. And these are just some areas to start. There's many different ways that you can write about your experiences in public health, but that is a way to create content, but it's also a way of establishing yourself as a thought leader in the field of public health. And that, I think, is really where you start to get into the interesting work about building your personal brand. When people actually see what you're about and what perspectives you're taking and what you have to say, they start to tune into what you are posting on social media a bit more, and they might actually take that from an online relationship to an offline relationship where they want to engage with you for work purposes or collaboration with your organization. That's a way of really enhancing your personal brand. And so what I would say is that really each person's journey in social media is unique. Some people like to observe for a couple months and then start to engage more readily. Some people like to just jump right in. Some people like to only do sharing articles, and other people like to write and actually share their own content. Whatever it is, it matters what feels right to you. But this is just a way of knowing what are the possibilities and what is out there. One thing I wanted to highlight in particular was how to build your community on social media, because sometimes it's really interesting to be part of this space, but it can feel very quick and it can feel not as ingrained in terms of as a solid relationship. And one of the ways, there's many different ways you can build a community, and I'll give you a few examples. One of them, if you're on Facebook, there are particular groups out there actually that are focused on the job search process. So one in particular for people interested in public health and health promotion jobs is job searching for public health and health promotion. So if you Google that into Facebook right now, you should see a group come up, and there's about 1,000 plus people in it, but there's always consistent job postings that are put on there. And that is probably not the only Facebook group out there, but that's just an example. It can really help you find community and also find places for particular jobs that you're interested in. Another one is if you're interested in specific niche areas, there might be Facebook groups or other types of groups related to that. So online on Facebook, if you type in Racial Health Equity Network, a Facebook group pops up. And that's for people that are specifically interested in that particular part of public health. On LinkedIn, I haven't talked a lot about that, but you typically put your professional experience on that site, but you can actually use that as a way to connect with people as well. So OPHA has a LinkedIn group. Your alma mater, wherever you did your undergrad or grad degree from or other degree from, probably has a LinkedIn community as well, and that's a way of further enhancing your professional development and professional network. And finally, there's also multiple blogs and listservs that you can use to connect with people. One is the OPHA Public Health Files. There's also a new entrant into the field of public health, which is called PH Spot, and they have a lot of blogs and jobs and other really interesting content on their website. For people that are based in Ontario and based in health promotion, there's also the Health Promotion Online e-Bulletin, and that's another way of consistently being engaged in the community through an online means. One thing that I wanted to share as a skill and as an interesting part specifically of Twitter that I don't think is leveraged enough by people in public health are Twitter chats. So Twitter chats, in layman's terms, are basically your business networking event online. It's a really interesting way of engaging with people that have similar interests like you in conversations about issues that are timely and important to your particular field of interest. It's a way of actually sharing your knowledge and expertise and sharing what you know in terms of best practices and also expanding your horizon and perspectives. And it's a really interesting way of building that thought leadership where you get to widen your network but also your influence. So for folks that haven't heard of Twitter chats, I'm going to give you 4 quick tips about how to make an impact there. So tips for being successful. So Twitter chats, like I mentioned, are essentially a regular activity that happens on Twitter for a particular topic area. So for example, there are Twitter chats specifically for chronic health, and there's specific Twitter chats for specific aspects of public health that people mentioned, whether it's aging or reproductive health or what have you. You can actually, on a regular basis, engage with people interested in that topic and actually talk about the different dimensions of that particular issue. And what I would say for people that want to engage in their first Twitter chat is to do your research, prepare. Often for the more established Twitter chats, they have a weekly or monthly theme. So do a bit of research on it. Figure out what it is you would want to say and prepare for that opportunity. I would also say it's really helpful to use a tool like TweetChat. So TweetChat is a tool that helps you essentially see everything that's happening as a conversation for a particular hashtag. It's coming up on the screen soon. Okay, so we're just having some difficulties, but hopefully it'll come up. But a tool like TweetChat is really helpful in terms of really seeing everything that's out there in terms of the specific hashtag that you're using. I would really recommend you take Google it, and you'll be able to see how it looks like. We'll see if we can put it back on the screen in a bit. I would also say when you are engaging in Twitter chats, it's really important to get the basics down in terms of the Twitter etiquette. Who knew Twitter had etiquette? But it does. So this is actually really helpful. Oh, so there you can see on the screen the Twitter chat. So this is how it looks like. So for example, this hashtag here is a hashtag SDOH, and if I want to engage in the conversations happening, I can actually get a running stream of what is being posted in real time. So instead of refreshing my Twitter all the time to see what's happening in this hashtag, it just automatically populates that. So here we see people talking about the racial wealth gap, and we see people talking about community health workers, and we see people talking about income inequality, and actually people asking questions. So you can easily connect with all of these different things at the same time. And when you're doing a tweet chat, you'll see the amount of information that comes in is quite rapid. So something like this is really helpful. So the other thing I want to talk about is Twitter etiquette. So Twitter etiquette this is something that you can use all the time, but it's if you're at an event and you're about to live tweet and you know you're probably going to have at least 20 tweets about the same topic, some people, what they like to do is just say, hey, I'm at this conference. I'm going to be tweeting a whole lot about this particular issue. Don't mind me. And some people really like doing that because it just lets their Twitter community know, whoever's following them, that this is going to come down the pipeline. That's not necessary, but some people like to do that. Also, it's really great when you're in a Twitter chat to actually use the hashtag that's being used so people can follow along. Also, for Twitter chats, often there might be 2 or 3 questions. So just really labeling your answer with answer 1, A1, and just answering your thought, that's really helpful for people that are following the conversation. And finally, I would say one of the important things about really sustaining your community is to ensure that you do the follow-up. So just like at a networking event, if you took someone's business card, you would send them an email the next day. Similarly, if you engage with them online in a Twitter chat, it would be important to connect with them afterwards, whether following them or just sending them a quick tweet saying it was really great to connect with you. Let's stay in touch. It's sweet, it's simple, but it really makes an impact and really does demonstrate an impact in your professional development and networking. So that's all I have in terms of the Twitter chat. I finally just wanted to end on this point of authenticity. For me, I engage in social media because I see it's important in really amplifying issues and values I care about that, for example, health is a human right. And for you, it might be something different. It might be you want to engage more in a topic because you want to learn more or you want to do it for some other reason. It's really important to just really reflect and figure out what is your purpose or what is your specific want that you're hoping to address with this social media engagement, and really be authentic to it. Because at the end of the day, it's really truly about what you want to get out of the experience, and if you have a handle on that, what you put out there won't seem as inauthentic because you've done that work and have really thought about what type of persona you want to put out there. So in terms of that presentation, that concludes it. And so I wanted to share some of the hashtags that I use, but also my Twitter profile in case you want to connect with me online after the presentation. I see a few questions here, so I want to address them. So a question from Stanley is, other than hashtags and tagging, what kind of language buzzword can you use to engage your audience and start a conversation? So this is actually fantastic. And so one of the things I've seen, and some people are still debating this, is what purpose is there, or how can we engage with people that typically don't think about the issues we care about? So you had mentioned earlier engaging in health promotion campaigns. What I've seen people start to do, especially on some of the newer platforms like Instagram, is actually look at hashtags that are quite important, that are quite popular in things that you might not typically engage with from a public health or health equity perspective, to see what is it that makes that hashtag popular. Are there ways that you can leverage that in the work that you do? So some of the things I've seen is that there's a lot of popularity with hashtags concerning personal fitness. How can that be leveraged to start to bring the conversation to other health promotion or public health campaign topics that you might want? So one of them might be using things like hashtags and tagging, but using the unusual suspects to get your message across. So using things that are not typically seen in the public health view, but reframing it in that way. So that might be something to think about. It's a bit more creative, but it's something that people are starting to look at from a public health perspective. So in terms of, you recommend Twitter, which is mainly people seeking information based on their area of interest. How would you suggest engaging the general population in advocating for healthy lifestyles? So great question. So you're right. Twitter is often very unidirectional in that the person that's on it is seeking only the information that they want. So similar to my previous answer, I would say using the components of social media in a unique or creative way might be what helps people actually engage in your content. So one of the things that I said was using visuals. And on some of these platforms, you can actually even use video. So using those features to bring in a very interesting message might be the way of bridging the divide or connecting with people that might not typically connect with your work. And that's what will help make it more viral or make it more shareable. Using those elements like images and video and using things that are not typically done in the typical public health way. Oh, yes, Jen, not to worry. My colleague is actually sending the website as we speak, so hopefully that'll be posted soon. Is it useful to have a personal account and a public health account? So great question. And for myself, I actually just have the one account. And the reason for this is that I find it just easier in terms of the logistics of managing one account. In my previous workplaces, I would also be actually managing the Twitter account as well. So having my personal account, then a professional Unjim account, and then also an organizational account got very busy for me. So I would just have the one. The benefit of that is that you have everything in one location. Any conversations that you might be having won't get missed. So example, if someone sends you a direct message in Twitter, you won't miss it because you're on your other account. You can always be readily available. The downside of it is that everything is public in terms of anything that you post is very much available to your professional audience, but also your personal audience. So what I've actually seen people do, and I would recommend this, is that there's so many different platforms for social media. There's Instagram, there's Facebook, there's Twitter. So you might use one of those for your more professional social media presence, and you might use one of the others for more of your hobbies and more personal things. So I know people often use their Instagram for their more personal side or personal perspective, and they use Twitter for their more public-facing or professional perspective. So that might be something to think about. And then there's other people that just have it personal/professional for everything, and everything is public. And that's up to you in terms of how comfortable you feel sharing that information. The one thing I will say about Twitter is that there is the opportunity to make things private or public, so that is something that you could look at. And you can use that as an opportunity to test out your presence, and when you feel comfortable, you can open it up, and when you don't, you can always make it more private, so there is that option. I see a few more questions, so I definitely want to answer these. Let's see. Okay. In terms of, I'll just speak just broadly about social media. I have seen the growth of social media in public health grow exponentially. It has been something that a lot of people in public health are using. It's where people in their public health schooling especially are using to find out about interesting events and webinars and articles. If you're someone that's interested in a particular area, finding the hashtag is really great. Oh yeah, someone had a question about how much time to spend on social media. And to be honest, I would say less is more. You don't need to be on social media 24/7 to really make an impact. It could be as simple as 20-30 minutes a day. Some people like to share an interesting article once a day, and that's their goal. Other people want to just observe what is happening. I know for myself, I use it as my own news feed for seeing what is happening in not just public health, but just the larger Toronto or Canada community. one of the one of the comments here is check with your employer. Some workplaces have policies that restrict who can represent the organization on social media platforms. Our organization also provides a disclaimer for personal social media accounts. So that is an excellent point from Hamilton LG that it's important to double check. For the organizations I've been part of, they've been quite open about it, but you're right, absolutely. Some organizations do not want that social media presence for their employers unless it's the CEO. So that's something to be considerate of. Can you share the link for the LinkedIn group for your alma mater? So your alma mater is, more generally speaking, wherever you went. So for example, if you went to Waterloo for their public health program, there is probably a LinkedIn group for that community, or for any other place that you attended school at. So it changes per person. Right. And okay. Any other questions that people have that they're hoping to ask? Okay. I think with that, we will conclude. And like that, the hour just flew by. Thank you, all of you, for listening and engaging and sharing your thoughts on social media and public health. I hope what I've shared here today has been helpful, and you take one of these particular lessons and apply it in your own social media. Feel free, if you have any other questions, to connect with me at Anjum Sultana on Twitter. You're more than welcome to chat, and we can continue the conversation there. And with that, I'd like to conclude. Thank you again, everyone, and I hope you have a great, great afternoon today. Great. Bye for now.